Welcome to Health Professionals Outside the Box podcast. In this series, I'll be talking to health professionals who've leveraged their professional skills to pursue alternative income sources, alternative careers, and entrepreneurship. We will gain insight into their motivations, experiences, and challenges, and learn how we too can carve our own path to finding purpose, fulfillment, and financial freedom. I'm your host, Fee. Thank you for listening. Welcome back to this episode. Today, I'm speaking to Abigail Morakinyo. She's a registered nurse and specialist in public health. She founded a company called Health in Check, and she's here to tell us more about it. Abigail, welcome.
Hi, Fee. Thank you so much for having me.
Thank you for coming to join me. I'm so excited to talk to you today about your business and what you're doing. So can you give us a bit of a background about yourself and your professional background as well?
Sure, perfect. So my name's Abigail Morakinyo, and I am a registered nurse by profession. I sort of started off as a general nurse. So by that, I mean my specialty was just working on a general ward, adult ward. But kind of like 3 years into my career, after I gained enough kind of like experience and confidence, I decided to specialize. And the area that I went into was dermatology nursing, because I was just really interested about skin and kind of like the different skin conditions that were. And it's sort of really helpful because my first daughter, she actually had really bad eczema. And I was so happy because the information that I had gathered working as a dermatologist nurse actually helped in me treating my daughter, because I'm not one of those people that like steroids, so let alone putting it on a young child. And but anyway, my background is nursing, specialized in adult, dermatology. But less than 5 years ago, about 3 years ago, I decided that I really wanted more. And by more, what I meant was, yes, I was happy, nursing, but I wanted more because I knew that I had so much in me that I needed to kind of like share with the world, as it were. And as a nurse who, I was earning a decent amount, I felt like, is there any other nurses who are possibly pursuing, alternative careers or even starting businesses? But there wasn't many that I could look to. So for me, I kind of like had to do a lot of research. I had to do kind of like, try to find at least someone that I could emulate, or someone that could kind of like coach me or guide me. And that's kind of like one of the reasons why I decided to do this, this podcast with you today, because I just want to say that there's possibly are other nurses who are working, but they have a lot to give. They have a lot of skills, but they don't know how to utilize or to transfer that skill into, starting up a business. And the thing is, you don't have to leave nursing. There's so much things that you could do that can possibly even complement, But yeah, so that's my background, really. Adult nursing. I decided to start my company, which you mentioned, Health in Check. And Health in Check basically is a company that basically specializes in prevention and intervention health services. And we work with companies basically who want to ensure or promote health within their employees in the organization. And obviously with what's going on now in COVID, we need a lot of that right now. We need a lot of health professionals coming up and helping people, to the mental health conditions going on right now.
How did you get the idea or the concept of the business?
So I actually worked with a company who contracted me as a occupational health nurse. So I looked at the company, I looked at their model, I looked at how they were doing things. And basically I thought, well, in a sense, I'm the middleman So, you've got this company that's been run by people with no nursing or even health background, but what they do is they actually contract nurses to go into the to certain workplaces and get them to do health checks for their employees. So I had to have a look and see kind of like how they operated. So that gave me an idea, and I decided, you know what, I can do this. So I'm doing, in a sense, is cutting out the middleman and just saying, you know what, you're going to hire someone who's going to hire me, but you're going to pay a lot of money. But I think in order to, as an incentivize for companies, it's like a no-brainer, really.
So it sounds like you saw an opportunity there and you jumped right on it straight away.
Yeah, absolutely.
So did you take on additional training or courses before starting your business?
Yeah, absolutely. So, I mean, first of all, I say, when I say additional training, this were things like I didn't have to go. For me, I'm a mum of 2. So my youngest is 5 years old. My eldest is 7. So in terms of working, because obviously with being a nurse, you can't give up the professional, because you have to still maintain your professional practice so that you can stay on the register. So I was still working part-time, but I also had to juggle, family as well. So there was no way that I could go and start, going back and maybe do like a top-up degree or extra. But what I did do was I knew that I needed business, I needed business skills. I needed to learn a lot more about how to operate a business, how to manage one as well. Because coming from a nursing background, just because I've got the skills to offer the service, as it were, I don't necessarily have the business acumen to run the business. So yeah, that was one that I did. Then obviously I do
what specific course? Sorry, what training did you say you did?
Oh, business studies.
Oh, business studies. Okay.
Yes, and then I also did some other little I have like agencies that send you off on study days. So those kind of things, just anything that I know would help me to offer a better service.
How did you balance that time? It must have been difficult working part-time as a nurse and then working on your business.
Yeah, it was difficult. And I think that's probably one of the reasons why people give up early on, or they don't even start at all, I'm not going to say that it's been rosy or it's been a walk in the park, but I can guarantee you that there is nothing more fulfilling than when you start something and then you start seeing, the fruits that it produces. Because, let's be honest, the day you plant an apple seed, that's not the day that you're going to start eating apples. You understand?
No.
You've got to let it nurture, you've got to grow it. But yeah, so yes, it's been difficult, but I think it really helped that I also kind of like had like a network of supportive women who were also, they weren't necessarily nurses, but they were women who obviously wanted to start their own business as well. So it's quite important that you have a supportive network. Yeah.
And how long did it take though, from setting up the business to then eventually getting your first client?
Okay, so I started the business about, like I said, 3 years ago. Well, that's when I registered the business. That's when the whole idea came about. But I did not get my first client or paying client till late last year, so November of 2020.
All right, okay.
Paying client. So I have actually offered complimentary services to other companies. The first complimentary service I offered was the year before that, and that was WeWork. And then last year, I was able to reach out to Camden and Islington Mental Health Trust, and I did a wellbeing day for them, and they were my first paying client.
How do you advertise the services, or what channels did you use to find clients? So
one of the channels that I use is good old Google search. Okay, so first of all, you have to have an idea of the kind of clients or the sort of people that you want to work with, and then it's all about literally Google searching and finding out who would be, the person to speak to. So one of the channels is LinkedIn. LinkedIn is really good. And you can do something as simple as just sending a email, reaching out to someone, introducing yourself. I mean, now with everyone being at home, it's probably going to be easier because everyone's online. But yeah, last year when things were still a little bit normal, it was certainly, harder. So I did a bit more of networking. I did a bit more of going out, and talking, meeting people. They would point me in one direction, and then all I'll do is just, try and get a contact by doing a Google search. But now, obviously, with the lockdown and people being at home, it's literally just online. But you can't just sell to people without first building some sort of relationship. You know what I mean?
That's a really good point you've raised there. I think it's so key to build and nurture relationships so that people can know who you are, know your brand, and gain trust. And it's within those relationships that you might just be able to find or connect with potential clients.
Absolutely.
Yeah.
Absolutely.
Have you left your clinical role, or are you still working?
Okay. And I think this is the advantage that nurses have, because unlike other jobs whereby it's either you work full-time or part-time at the most, but with nursing, you don't have to commit to a full-time contract. So at the moment, I'm not working full-time. I'm operating on what we call like a bank or agency. So basically I choose when I want to work. So for example, if I knew that, okay, this week I'm going to have a very busy week in my business, I need to work on it. You understand, I won't work at all. But then the following week, I can choose to work 1 or 2 days. And that really has been really helpful in terms of giving me balance and structure, with my home. Right now, we're all in lockdown. Schools are shut. So if I didn't have that opportunity, it would be really hard.
How did you raise capital?
It was all saved money. Some help from family, but majority of it was just saved money.
Did you save it at the point where you had the idea to start the business, or are you generally a person that saves money?
In general, I would say that yes, I am. However, the point, and I'm just going to be open here, nursing it's a job, it's a profession that can drain you mentally and physically. So I think at the point when I had my second child, I had already started what I call my exit plan, and from that time when I realized that, I'm going to give myself another year, and then I need to kind of like not be reliant or dependent on a job. So that's when I was intentional about putting a certain amount away every month. So it was all about delayed gratification. So yes, I wanted to go on a few holidays. Yes, I wanted to, buy this or have that. But I was able to actually say, do you know what? I'm not looking at what I can't have at the moment, but I'm focusing on what I'm going to attain or achieve, So yeah.
On your website, it says that the company has since grown to work with several other nurses and other health and well-being experts. So I take it you've employed other colleagues.
Yeah, not on a full-time basis, but see, as and when.
Okay, so it's ad hoc basis.
That's right. Okay.
And what factors do you think have contributed to the growth of your company today?
The factors that have contributed to its growth, I'm not going to lie, social media has been a very, very useful and helpful tool. And like I said, I think the more value that you give, the more value that you put out there, then you're going to have people coming to you and being like, okay, oh, this is interesting. Tell me more about what you do and what you can offer. And then from there, that's how growth starts.
So when you say value, what do you mean by that?
So it's media. For example, now I used to do kind of like a weekly Ask Abby, what's it called? Ask Abby.
Like a question live. Time.
Exactly, where people can just come and just ask a question. And I did this kind of like before. No, actually, I think it was around March. So yeah, just before we had the initial lockdown. And I didn't even know that it was going to be the case that GPs will be closed down. Like, I can't remember the last time I sat face to face with my GP. You know, it's been that long. So a lot of people are literally at home now, and they're scared because, like, if anything was to happen, you haven't got that primary care, you know, intervention right now. And with A&E, you know, you can't just turn up an A&E and be like, oh, you know what, I've cut my finger, because they're only seeing emergency
cases.
You know, you can't breathe, and you know, so yeah, yeah, I think in terms of value, it's just about going out there, showing up, and being there for people, and people knowing that, okay, you know what, if I've got a question or if I've got this problem, this person has been showing up, this person is, you know, they're knowledgeable, they know what they're talking about, and we can utilize their service, or we can utilize their help. And it's about cross referral as well.
So were you answering questions to do with COVID, just general health questions?
Yeah, general health questions, even things like, you know, how to do first aid at home, you know, because I remember when I worked in A&E, we had a lot of people who would come with like not knife injuries, but like they're simple things, like they were cutting an avocado and obviously it sliced their fingers. So they come to A&E, or it could even just be sometimes paper cut. Yes, paper cut. It was like, some were serious, but some you just literally had to laugh at. This is basic first aid. But it just goes to show that some people just don't know. And I think it's, you know, you can't kind of, you can't take that for granted, that some people, you know, really don't know what to do if they're fingers. So I just went on there, and I had quite a, you know, a lot of feedback saying that, oh, wow, you know, I've never thought about having a first aid box at home. But because of that, you know, they've gone and done that.
So your website indicates that you offer health and well-being workshops at company sites. What's the uptake like?
Do you know what? It's, I think the last wellbeing day, I call it Know Your Numbers, and it's basically just doing health screens like your blood pressure, cholesterol, diabetes. The last time I had 25 employees turn up, and even at the end of it, you know, the organizer was like, is there any way, you know, you could see we've got like 3-4 more people, and obviously, you know, there's a set number of people that we can see in a day. So yeah, it's very, very, very useful. And one of the things as well that people, you know, feedback that I've gotten is, in a whole day or a whole working day, you could be sat at your desk and literally just working. Like, these are people who probably even have lunch sitting at their desk. So there's minimal movement. So they're like, do you know what, this 15 minutes that I've spent with you, like, just not having to think about work and literally just coming here and, you know, talking to you, it was like, it's like gold to them, you know.
It makes a big difference, doesn't it?
Absolutely. Like, it just breaks up the monotony of the day. And, you know, so yeah, I mean, now with COVID, we do a lot less of face to face, but yeah, I can't wait for things to go back, because I know that there are a lot of people who literally do need, you know, yeah. Just
have you managed to transfer some of your services online?
Online, yes. So I hate to use that word, pivoted, because that's another
it is
word. Apart from, you know, am I on mute? Can you hear me? But yeah, I literally did have to pivot, because now I'm looking at digital products that I can provide. And obviously I do a lot of online masterclasses. December, I did a breast awareness and breast cancer workshop, and that was quite had quite a good turn up on that. Absolutely.
What transferable skills do you think have added value to your current business?
Definitely the fact that I can actually do health screens. That's one. So I like that fact that, you know, because I don't like to be that kind of person that, you know, you have a business and you just kind of, I like to be involved, hands-on. So literally picking up my skills from nursing and being able to apply that even in places that are not like hospitals. So being able to do that in the community, in the workplace, other skills such as communication, and even just how to be able to explain things to people in a way that they don't feel like, oh, this is jargon or this is like medical lingo. So just being able to still have that personal touch, speak to people, reassure them, but also kind of like give them the information that they need to be able to basically, make better health choices, build better habits, and just basically.
I think we underestimate the wealth of skills that we have acquired over the years. So during training and whilst we're working, and I think we struggle to identify how we can, how those skills can be transferable or applicable to a career change or starting a business.
I know there's a lot of, on Clubhouse, I think I joined a group yesterday, and they were talking about how 2021 is just going to be a year of collaboration. And just like you mentioned about, nurses and healthcare professionals having transferable skills. But if you think about it, this is what we do in a hospital. We collaborate, but we call it, talking within the multidisciplinary team. It's about how can I work with, say, the physio to ensure that this patient, when they go home, they're going to be safe. They can use their crutches properly. How can I work with, I don't know, say, social care or social services to make sure that when this person goes home, their home environment is safe for them. So constantly, we're working with other people, not necessarily who have our own skills, but we're working within that multidisciplinary team. So in a way, we are collaborating. So we really, really should not underestimate ourselves and the value that we bring and everything that we have within us, so it's a good point you made there.
So we know that having a business has the potential to cause stress with pressure, constantly finding ways to grow it, manage stuff. What has been the most challenging aspect of running the business for you, and how do you cope with the pressures whilst keeping yourself motivated?
Brilliant question. So by far, I think one of the greatest pressure for me is sustainability, because when you first start the business, and for me, luckily, I didn't start with a loan. Like I said, I was able to save, and it was literally just about, my startup cost was not that much. The most or where the money went into really was just getting the equipment and possibly all the like minor details like getting a website, that kind of thing. But then afterwards, I still had to do a lot of promotion. So I was, spending money on marketing. And like I said, I didn't get my first paying client until late last year, So it's just like a baby, before the baby starts walking, you still have to invest and help that baby walk. You're still going to have to buy things like a stroller or what is it again? A walker, those things that they hang on to and they try and walk. You're still going to have to invest in, proper shoes that give them support. But then when they start walking, it's, it's worth it, So I think for me, yes, sustainability, just obviously trying to make sure that the business is still standing, even though it's not, money in. Yeah. And then also don't underestimate never underestimate how it can be very lonely starting a business. I know people make it look glamorous. It can actually be quite lonely. And I know that people glamorize it and make it look as if like, business is this glamorous lifestyle. It's it's not. It can be very lonely. Like I said, not a lot of people will understand. Like for me, no one understood why I wanted to give up a job that was paying me a good salary consistently for it to people. It was like, am I chasing a hobby? No, it's more than that. It's a vision that I have. I have a vision where I see, particularly working mums not have to sacrifice their health for their careers or for their families. But, we're living well because we know better. And not only do we know better, but we act better, So, yeah, I think obviously just finance, and then also the fact that it can be lonely. that really, really did put a lot of pressure on me. Sometimes I felt like, you know what, I just want to stop. I just want to quit. But then I remembered what I've given up, and I'm like, you know what, I've got no other options but to keep going. You know, so I think for me, it's literally just surrounding myself with positive people, because you just need that person who's going to be like, okay, you're a great person. You're fantastic. You know, what you have to offer, people need this. So you can't, and that just keeps me going.
What sources of support do you have?
I have, like I said, I have support networks. I'm in WhatsApp groups. I'm in, you know, yeah, just different kind of like support groups, either on Facebook, WhatsApp, wherever. But yeah, just go where you know you'll find your tribe, and your tribe are people who are walking in the shoe that you're walking, or perhaps they're already where you aspire to get to. So it's just basically people that will offer you support and not just try and discourage you.
True. And it's being intentional about it, looking for those networks, because I think that can help with that loneliness. If maybe, particularly for people where maybe relatives or friends don't understand what you're doing, and they're not being not overly supportive. So what's been the most fulfilling aspect, do you think, of owning a business?
Oh, by far, I think it would just be the fact that my two little girls, you know, they know about my business. You know, it's like, oh, health in check. And, you know, like the other day, my 7-year-old, she had a video and she's making like a fruit salad with her sister. And it was just about, you know, it's just like they're picking up of what I'm doing. You know what I mean? So it's like, for me, I've started the legacy. So for me to have two young girls who are looking up to me and who are like, you know, they're proud of what I'm doing, that for me, I think that's it. I mean, everyone, I want to make a difference out in the world, which I do. But if I'm not making a difference to the two little girls that I have, then, you know what I mean? It has to start from the home. It has to start, you know, from your own environment. And when I see them and how they are and how they, you know, they kind of like to say, oh, mommy, you know, that's you, you know, when they see my live videos and like, oh, mom, you look so good. And they don't know what I'm talking about, but they just see me, they just see me doing my stuff. And they are, they're my biggest fans.
I guess you've answered part of my question there. I was just going to ask how being an entrepreneur has affected your life.
Oh yeah, positively, absolutely. Even like you said, I'm hoping that I would encourage other nurses who may be listening to this. You know, you've got something inside of you. You've got something to offer, something to give. Like, don't limit your knowledge to the four walls of a hospital. Like, there's a lot out there to be done.
On that point, I was reading from the Royal College of Nursing, an article that was released in July last year, and they were saying that there are about 40,000 nursing vacancies. And that was pre-pandemic. So that number has increased to approximately 50,000.
Oh, yeah.
Saying the proportion of nurses, there's an increased proportion of nurses that are considering leaving the profession. And the main reasons that have been cited are the salaries and burnout.
Yes.
So if you were to give a word of advice, a piece of advice, what questions do you think people or nurses would have to ask themselves before considering starting a new venture?
Yeah. Okay. So I'll first address the issue of salary. Now, when I went into nursing, I didn't go into nursing with the notion that I would become a millionaire, you know, from that profession. I mean, hardly is there any profession that you go into that will make you a millionaire. Absolutely not. We you know, as nurses, we go into the profession with the simple, well, I hope that's the case, but we go in with the simple notion that we literally just want to make a difference, you know, to people. They come in sick, they come in, you know, scared, anxious, coming for a procedure, but by the time they leave, they are more confident, they feel better, you know. But if I was to give an advice, really what I would say is, you first of all need to discover your why. Like, if you were going to start a business or whatever venture you were going to do, there has to be a why. Because if that why is strong, no matter what challenges comes your way, that why is going to always pull you back to the center and make you remember why you started and why you need to keep going. So yeah, don't just start it because, oh, I'm fed up of the NHS, or I'm fed up of work, and I've seen other people do this and I just want to do, it has to be, there has to be a strong why. There has to be a purpose,
You've written a book called The Wow Factor.
Oh yeah. Oh, that was a long time ago.
Well, you say that the book was to encourage and inspire people to reach their full potential.
Yes.
In your view, what's reaching your full potential?
In my view, okay, so I was discussing this with someone the other day, actually. I can't really even define what potential is, but what I mean is that whenever there's something in you, you need to be able to put simply, to be able to get it out of you. I believe that there's a reason why, like I'm a woman of faith, so I say God, but it doesn't matter, whatever you believe, whatever religion. But I believe that whenever God puts something inside of you, it's not to stay in there, it's for it to come out. And reaching your full potential could possibly be that whatever or whoever you need to become, or whatever you need to kind of, whatever you need to become for that thing to come out, and when I say whatever you need to become, like 3 years ago, I wasn't doing public speaking in the sense that obviously I'm talking to my patients, but I wasn't coming out on live TV and looking at myself and
on public platforms.
Exactly. So I had to become a public speaker. I had to become, like, even doing interviews, I wasn't doing interviews because I was just a little old nurse doing my bit for the community. But now I've in order for me to reach the potential of being a influencer or a leader, I have to become something. I have, something is inside of me and it needs to come out. So that is reaching your full potential. But it doesn't stop there, because in a few years, things will change. There's going to be something else that you need to achieve. And then you're going to have to become even better. Yeah. Otherwise, we would have just stopped at nursery school. We wouldn't have gone to primary school, or we wouldn't have gone to secondary school. But there's always levels. And in order to, attain a different level, you need to become a better version of yourself each time.
Do you think you've reached your full potential?
No, because there's still a hell of a lot more inside of me.
And what's your vision for the future then, with regards to your business or professionally or personally? What's your vision? So my vision, my personal vision is that, one, I'm financially free. And when I say financially free, is that I have the gift of time. I have choices. I have the gift of choices, being able to make choices, and not have things still dictating to me, So yeah, that's it. Just being able to be a blessing to myself, my family, community, the world at large. And, even professionally, I see myself, just basically inspiring, other healthcare professionals, nurses in particular, because I'm a nurse myself, to basically step out of what they know. So, and to step into the unknown, and to basically make full use of every single skill and gift that they have in them. We've got some of the best nurses who are not using their full potential, as we've discussed, who are not using their gifts, and they are, you said, they're getting tired, they're getting frustrated, and they're just quitting. But yeah, myself, just basically being someone that people can point to and be like, you know what, if she did it, so can I. And how far are you planning on taking the company?
Global. global. That's it. Especially now that I'm building a digital platform, I don't see that being a problem. But it's a lot of work. But
Right. And how do you unwind?
it's actually just, for some people might be boring, but for me, I am a fashion addict, so I love all things fashion. So it's literally just even looking at magazines, Vogue sometimes, and more importantly, I read a lot, because I think there's a lot of information hidden in books, and if you don't read it, you won't know. Focusing away from like business, the stress of life, and just reading a good book, them books that you can pick up lots of like aha moments from. Yeah.
Well, thank you very much, Abigail. It's been really interesting talking to you. And I really appreciate you coming on this platform to just share that with us. Where can people find you if they wanted to know more or ask you questions directly?
Absolutely. So I am on Instagram as wellnurse. So not wellness, it's wellnurse, WELL and then NURSE, wellnurse Abigail, ABIGAIL. I'm also on Clubhouse. So if you're on Clubhouse, please, jump on, follow me, and we can have interesting discussions. My Clubhouse handle is at wellnurse Abby. So it's just Abby, ABI. And yeah, if you want to send me a direct email me at Abby so ABI at healthincheck.co.uk.
Okay, so I'll be sure to put those contact details at the end of the show notes. Well, thank you so much for your time, and I wish you the very best with your business and your future.
Thank you so much. Thank you, Fee.
Thank you for listening to this episode. If you like the podcast, please subscribe, rate it, and review it on iTunes, as this can help others find it. If you'd like updates on the podcast, you can follow the pages on Instagram or Facebook by searching for Well Restorer. If you have any questions or would like to give some feedback, you can send an email to info@wellrestorer.co.uk. Thanks once again. Take care.